Let's start meningitis with a clinical scenario. A 4-year-old boy is brought to the emergency department after developing a high grade fever, severe headache, and neck stiffness. On examination, he has photophobia and a positive Brudzinski and Kernick sign. So, what should come to your mind? It's meningitis. So, meningitis presents with following signs and symptoms as high grade fever, severe headache, neck stiffness, photophobia, and positive Brudzinski and Kernick sign. But here is an important clinical point. The neonates mostly doesn't show these signs all of them. They can present with high-pitched cry, bulging fontanelle, irritability, and poor feeding. So you have to be very cautious with the neonates. So what is meningitis by definition? You can remember it from meninge, that is meninges, and itis, that means inflammation. So it is inflammation of the meninges that are the protective membrane surrounding the brain and the spinal cord both. So, how to demonstrate the two most important signs, like Brudzinski sign and Kernick sign? So, Brudzinski sign occurs when flexion of the neck causes involuntary flexion of the hip and knees. Another is Kernick sign, where extension of the knee causes pain and resistance. So, now the most important organisms for the exams that are very high yield include the organisms that cause meningitis in neonates. You can remember from the mnemonic bell. So from B, it is group B Streptococcus, from E coli, from L Listeria monocytogenes, and in older children, it's a silly mnemonic SHN, Sehen, so Streptococcus pneumonia, H influenza, and N meningitis. So the diagnostic test for meningitis is LP. So the most important diagnostic test is LP. You have to perform LP and see whether it is viral, bacterial, or tuberculous meningitis. And then this guides us the treatment whether we will give anti-tuberculous therapy, antiviral therapy, or antibiotics depending upon the cause. So now the most important clinical pearl is that if the suspicion is too high, you don't wait for the LP results and you start the treatment immediately because meningitis can cause a lot of serious complications, as we will discuss in detail further. Now, another important clinical pearl is that never perform an LP if you have suspected raised intracranial pressure, because performing an LP can lead to brain herniation then. So, in such cases, always perform a CT scan first to rule out raised intracranial pressure. So now comes the LP report. An LP report is very important and high yield for exams and also clinically to diagnose which type of meningitis you are dealing with. So first look at the glucose. The glucose will be normal in virus while it will be low in tuberculous and bacterial meningitis. A silly mnemonic is there to remember that virus is non-living, so it doesn't eat up glucose and glucose remains normal, whereas bacteria and TB eat all the glucose, so glucose is low. So now come the type of WBCs that are raised. So neutrophils are raised in bacterial type of meningitis, whereas lymphocytes are raised in viral and tuberculous meningitis. Protein is high in all of three, so it doesn't matter. So now comes the empiric treatment for suspected meningitis that is very important clinically. So we start with the IV antibiotics, and in IV antibiotics we give a gram positive cover and a gram negative cover. So gram positive cover includes vancomycin and a gram negative cover includes ceftriaxone. As we know that ceftriaxone can cross the blood-brain barrier. Now come the IV steroids. We give IV steroids always before the IV antibiotics, and the reason is because rapid bacterial killing releases inflammatory mediators that can worsen brain inflammation. So please remember this rule always. Then comes acyclovir. If there is concern for viral meningitis and especially HSV, then we add acyclovir. So the complications of meningitis are very important, and because of that we give the early treatment. And they include hearing loss that occurs due to involvement of inner ear structures, seizures, and cerebral palsy, and hydrocephalus, and cognitive impairment. So please like, share, and subscribe to learn pediatric topics simply, clinically, and in an exam high yield way. It's Dr. Yumna here. Thank you so much.